I just want to talk a little bit about, Norman and Donna spoke so well about why we're here. It's very simple. Everyone in, nobody out. We're talking about a system where there will be guaranteed health care for all. What does this mean? Comprehensive care. It means that there will be no financial barriers to any medically necessary treatment. You show me another plan in Massachusetts, in California, in Barack Obama's plan or Hillary Clinton's plan, where you can cover everyone comprehensively with no financial barriers. That requires the elimination of the health insurance industry. It requires the elimination of a healthcare system driven by profit rather than the needs of people. So why is it so difficult? We've got 57% of all the physicians in this country, physicians who decades ago opposed Medicare, and we're talking about HR 676, which if you look on your congressional website is expanded and improved Medicare for all. Well, these doctors had opposed Medicare. They opposed Medicare originally when it was first introduced. Now we've got 57% on board. If you look at many polls, voters would like to have national health care. And the New York Times did a poll several months ago which said that they would even pay higher taxes. Why? Because people are paying and they're not getting the treatment that they want. We're already paying the amount of money it would cost to cover us and to cover everyone. Everyone is covered, then as a society we're more productive, we're more healthy. So in the spirit of what Norman was talking about in terms of looking at historical moments, I want to call attention to the civil rights movement, because what PDA has created with the California Nurses Association, National Nurses Organizing Committee, the Healthcare Now group of Marilyn Clements, and Physicians for a National Health Program is a coalition called the Leadership Conference for Guaranteed Health Care. And Donna mentioned that the steelworkers had spoken. Leo Gerard, who's on the board of Healthcare Now, steelworkers are also a member organization of that coalition, dedicated to get this to happen, national health care for all. It was called the Leadership Conference because there was something back in the 60s called the Leadership Conference for Civil Rights.
Still alive.
And still alive. And those of us, well, I'm not really that, I can't really remember, but those of us who do remember will recall that there were a lot of naysayers about the civil rights legislation back then. And this conference was formed, a coalition was formed, there was political will, and there was a groundswell of support, and it came from below. It came from below, but what it resulted in was legislation on the federal level, and that's what Progressive Democrats of America is all about, and that's what we're going to do for single payer. And we're going to do it by being strategic, by being savvy. So if people don't understand what single payer means, we're going to tell them. We're going to tell them that it means publicly funded, but privately delivered. We're going to tell them that it means that you can choose your physician. That's not going to be taken away from you. That's going to mean that you're going to get quality treatment for all your illnesses. Donna was talking about, they mentioned chronic diseases at the platform committee. Well, chronic diseases are frequently not covered by certain insurance plans. Home care, which is required if you have one of these chronic diseases and you can't work, is not covered by an insurance plan. Affordable health insurance, well, that's nice, but what if you get so sick that you can't work and you don't have that affordable health insurance anymore? Well, the only solution is a national health care plan. So we've developed on the ground the Healthcare Not Warfare campaign, because we want to connect the issues and say that as a society, as Norman and Donna spoke to, we need to redirect our resources from military spending to human needs, and we need to do that to create a comprehensive national health care system. And we can do that because right now we're spending 33 cents on the dollar for health insurance, which is not covering, as we said, 47 million folks who have no insurance and the 50 million who don't have insurance that really matter when they get sick. People don't go to their doctors to diagnose diseases that are at some point curable because they don't have the money for their copays, because they can't meet their deductible. That's because we're always speaking the language of commerce and profit, and that's not what healthcare is about. It's a province of government. So this is where we can really make a difference. So I urge you to please still drive names to the Healthcare Not Warfare petition. You can find it at pdamerica.org. I encourage folks to also support the effort that we have now to actually make an effort to get our delegates on board with a national party platform. We've had the party platform accepted in Colorado, in California. Kay Tiller, who will speak after me, will talk about unions. Very frequently and historically in the past, labor has said, well, medical benefits, that's what we offer our members. Now they're not calling that too. Now we have not only unions saying we need to take health care off the table, it needs to be available for everyone because we don't want to lose jobs when employers go overseas because they don't want to pay the health care insurance premiums. We want to tell people about our win-win campaign, which will demonstrate that our property taxes, our school taxes can be lower because we're paying private health insurance companies to cover governmental employees. That's coming out of the pockets of taxpayers. We're going to find the arguments to bring on business, to bring on labor, to bring on local officials who don't, who don't have any money in their coffers, and we're going to make this happen. So I thank you all, and I'm going to let Kay begin to talk to us logistically about how we can fortify PDA by bringing on more union advocates. Thank you.